Senator Johnson. Sure. Yeah, why don't we do that if Senator Johnson is okay? So I actually am going to have Dr. Greg Watchmaker introduce Susan Bailey because Dr. Greg Watchmaker assisted me in connecting to Dr. Bailey, who's the current president of the AMA. And Dr. Greg Watchmaker, I'll put in a little plug, also wrote a wonderful chapter on the unintended negative consequences of regulating quality within healthcare. So maybe, Greg, you can touch on that a little bit as you introduce Dr. Bailey. So Dr. Watchmaker.
Good morning. Who are our heroes? For some, they were the make-believe characters from our youth. For others, like our speaker and American Medical Association President, Dr. Susan Bailey, they were the real people in her midst who inspired her to become a physician. I borrow from Dr. Bailey's inaugural speech, where she describes ordinary people with a love of the sciences and humanities who are elevated by the passion of a mentor or an experience during their training to become the real-world hero she and I envisioned in our youth. Following medical school, Dr. Bailey was a fellow at the Mayo Clinic Graduate School, where she trained in allergy and immunology, and returned to Texas, where she is in private practice. Dr. Bailey has dedicated her career not only to her own patients, but also to improving the practice of medicine across the nation through her leadership at the American Board of Medical Specialties, the Advisory Panel on Women in Medicine, and now as the AMA's 175th president. In Dr. Bailey's first speech as AMA president, she focused on how heroes have adversaries, and even the superheroes of comic books need the support of allies to overcome them. For physicians, adversaries take the form of difficult-to-treat diseases, but increasingly also the quagmire of federal regulations, insurance complexities, and now digital burnout. My colleagues in internal medicine now spend more hours interacting with computers than patients each clinic day. A study by the American Hospital Association found that an average-sized hospital requires over 50 full-time staff to comply with federal reporting that has grown with each federal administration. Medicine in America now emphasizes screen time more than patient time and documentation more than diagnosis. These forces move our focus away from our patient care and in the process not only harm our patients, but also increase the cost of care to us all. Dr. Bailey is an allergist, myself a hand surgeon. I know very little of the diseases she treats, and I would dare to guess that asking her to name the bones of the wrist and the treatment of their fractures would be equally difficult for her. What we share, though, is a fundamental grounding in science and the thought that recognition and treatment of human diseases is ever-changing and complex. The pandemic has put on full public display what we know today is not what we knew yesterday, and may be refuted tomorrow by new research that suggests flaws in our current understanding. The practice of medicine involves filtering, processing, and assimilation of new medical information, which is difficult enough for a physician who has trained decades to do so, and beyond the scope of federal policymakers who seek to influence the practice of medicine from afar. The book chapter Dan Sem asked me to write for Purple Solutions illuminates the travails of such efforts and how, in hindsight, the majority of the quality and regulatory programs, born of good intentions by bright people, have instead distracted physicians from good medicine and ultimately caused public harm. I borrow again from Dr. Bailey's inaugural address when I say that a hero's journey, like ours, is simple. In medicine, it's important to let doctors be doctors. I share with my fellow physicians and the patients we treat the hope that advocacy efforts of leaders like Dr. Bailey can again help us return the attention of medicine to our patients. I am proud to introduce the American Medical Association's 175th president, Dr. Susan Bailey.
Good morning. I am so glad to be here with you. I trying to get my slides up and to share the screen. I think I know the problems that Dr. McEnany had trying to get in. But while we're waiting for the slides and the split screen to be enabled, I'll go ahead and thank Dr. Watchmaker for that lovely introduction. My only comment is navicular. How's that? But that's about the only bone of the wrist I can remember. You're so kind to remember the words of my inaugural speech, which, because of the pandemic, I gave in a format very similar to this one, through a computer screen instead of in front of my dear friends at the American Medical Association. So I am so glad to be here with you, even if it is virtually, to talk about some areas of common ground that our leaders should be focusing on as we advance healthcare in America. I am still unable to start my video. It says because the host has stopped it and has disabled screen sharing. So we will keep going. Of course, COVID-19 changed medicine and our world seemingly overnight. And in many ways, these past few months have clarified the issues that have been hiding underneath the surface for a long time. Now, it's so unfortunate that conversations about science, here we go. Not so sure about the slides. And now I think I'm completely gone. Okay, I am back, although I can't enable my video again, so I will apologize for that and just keep going. We were talking about conversations about science, and most specifically healthcare. It is such a shame that these things are so often derailed by partisan bickering. If it wasn't clear before COVID, it certainly is clear now. The health of the American people must be guided by science and evidence and not politics. I am so proud to contribute to this conversation through the lens of the AMA, which actually was discovered in 1847 to combat rampant quackery in medicine. As partisan as our world is today, there are still issues in healthcare that greatly affect patients and physicians that have broad partisan support. The AMA itself is a proudly nonpartisan organization, and we're committed to working with both parties in Washington, D.C. and across every state to find these areas of common ground and advance policies that truly move medicine forward. So in the time I have today, I'll highlight some of these bipartisan issues and talk about how the AMA is working to make our health system more effective, more efficient, and simply work better for everyone. Because on everyone's minds, as it should be. Pandemic is an example of how health issues that should not be co-opted by politics, on the left and on the right. COVID-19 is complex, and even today, scientists don't know everything they need or want to know to aid in our response effort. But what we do know is rooted in science and evidence, and it's encouraging to see political leaders on both sides urging people to wear masks in public and practice safe social distancing. We've still got a long way to go in this fight, and it's an all hands on deck moment where we all need to be engaged in doing the basic things to slow the spread of this dangerous virus. Now, what's driving political divisions around these issues, whether it's COVID-19 or the safety of vaccines, is the torrent of misinformation and falsehoods that are so easily spread online, in social media, and really in the media at large. We must ensure that policy decisions are driven by facts and evidence and not ideology and politics. All of us need to trust that our institutions are keeping science at the forefront of their decision-making. That's why the AMA continues to call on elected officials and major institutions to affirm science and evidence in their words and actions as we continue to fight this pandemic. Now, since the beginning of this crisis, the AMA has worked to support physicians navigating this challenging landscape to protect themselves and their loved ones. Our response has been threefold. First, we're providing trusted, evidence-based resources and clear guidance to physicians on the front lines of the COVID-19 pandemic, which can be accessed for free on the AMA's website, ama-assn.org. Free for anyone who needs them, don't have to be a member. We're helping physicians and practices recover, secondly, from the disruption and the damage that has been done by the pandemic by pushing for loans and other forms of financial assistance for struggling practices and providing guidelines on how to open safely. And we're pushing at the highest levels of government to reduce obstacles to patient care, whether it's securing more personal protective equipment for frontline workers in the weeks and months ahead, or reiterating the need for widespread testing, both diagnostic and antibody testing, as states determine how to safely open. So, small physician practices like mine, I'm an allergist in private practice in Fort Worth, we've been hit particularly hard by the pandemic as patients become fearful about that they could be exposed if they go to a doctor's office. We continue to work with lawmakers on both sides of the aisle and press Congress to provide direct funding to frontline healthcare personnel and physician practices, as well as hospital and health systems, of course. The choices that Congress makes about funding will make the difference between the ability of America's healthcare system to overcome supply shortages, staffing shortages, and financial challenges so they can continue to serve their communities. Stimulus bills signed by the president have included a number of important provisions that the AMA championed. Included $175 billion in direct financial support to hospitals, physician practices, and other healthcare providers under the Public Health and Social Services Emergency Fund. Now, this support is for the costs of treating COVID-19 patients, as well as to ease the financial impact on those of us that lose revenue due to reductions in other services because of the pandemic. A new loan product within the SBA, the Small Business Administration, for loans of up to $10 million to help cover payroll and overhead costs with expanded loan forgiveness criteria. Physician practices with less than 500 employees may qualify. Now, early on in the crisis, AMA leadership spoke with President Trump and Vice President Pence about the need for federal coordination of production and distribution of PPE and test kits, and urged them to do everything in their power to alleviate the dangerous shortages we've been seeing. The issue becomes more critical as small private practices seek to reopen and need PPE. We need masks, we need gowns, we need gloves and other items that are in short supply. No medical professional should be in a situation where they don't have the protective gear or equipment they need to treat their patients and to protect themselves and their family members from COVID-19. We're currently pushing for diagnostic and widespread testing, antibody testing, as we continue to reopen state economies. And we'll urge the administration to do everything in its power to fast track testing. But as this pandemic continues to evolve, we continue to press Congress on the viability of physician practices. We've also encouraged Congress to include legislation with specific provisions to help physicians sustain their practices and provide their patients with the best possible care during the COVID-19 emergency in the fourth round stimulus bill. We've developed step-by-step guidelines for physicians to reopen their practices. These guidelines build on our ongoing efforts to ensure that physicians and healthcare professionals have the most up-to-date information and resources necessary to navigate the rapidly changing landscape of this pandemic. Now, let's talk a little bit about one thing that has grown even more rapidly than the virus, and that's telemedicine. Expanding telehealth is another issue that I believe has true bipartisan support and that physician leaders in the AMA and other organizations are working to advance. The AMA's Quick Guide to Telemedicine is among a number of free resources for physicians that can be found on the AMA's COVID-19 Resource Center on our website. Again, that's ama-assn.org. Now, there are no silver linings when it comes to COVID-19, but it is encouraging to see the paradigm shift toward telemedicine, which has become a lifeline, literally and figuratively, for so many. My own practice in Fort Worth from 0 to 100% telemedicine within a matter of days. Now, I've heard it said that telemedicine has advanced 10 years in 10 weeks because of the pandemic, and I believe it. The AMA has advocated forcefully for telemedicine as an option for care amid COVID-19. We've also developed a telehealth implementation playbook, which outlines a clear and efficient path to audio-visual visits. Now, one of the most significant barriers to wider adoption of telemedicine has been restrictions on where patients can receive care under Medicare rules. The AMA and many other organizations urged CMS to temporarily remove these restrictions so that Medicare patients can receive telemedicine benefits in their own homes, no matter where those homes are. We support this change and continue to work with Congress and policymakers at CMS to resolve outstanding questions. Now, these past few months have put strain on healthcare workers in ways that we could never have imagined. And this pandemic has added another layer onto the existing crisis of physician burnout. Research from before this pandemic painted a really grim picture of burnout in our profession. 44% of physicians reported at least one symptom of burnout. Physicians spend about 2 hours on EHRs and administrative work for every hour spent with patients, just like Dr. Watchmaker told you. 6 hours of every family physician's workday is consumed by EHRs and paperwork. 1 in 5 physicians is considering reducing their clinical hours. So the AMA has worked to be a national leader on this also bipartisan issue, declaring physician burnout a public health crisis and committing ourselves to not only raising awareness about it, but creating tools and resources to help reduce it. We're working to ease the documentation burden that physicians face that prevents them from giving patients their best care. We have an online system at the AMA called Steps Forward, which provides modules to help practices and hospital systems identify the issues that lead to burnout and come up with strategies to overcome them. Burnout is not an individual failing, it is a systems issue. And we launched the Practice Transformation Initiative last year, which has brought together state medical societies and a number of practices throughout the country to analyze evidence-based solutions to burnout and help scale those across the country. This initiative will also focus on a larger call to action in the industry. One area where we are seeing some progress is in reducing the paperwork burden in the clinical environment, which both parties support. Physicians spend a lot of time meeting burdensome and often usually unnecessary documentation requirements. This takes time away from their patients, as you have heard, contributes significantly to burnout and professional dissatisfaction. Last year, the AMA worked with other organizations and CMS to achieve the first overhaul of evaluation and management documentation and coding in more than 25 years. And we're working on other process simplifications that save physicians time. We continue to call for reforms of the burdensome prior authorization process that's required by health insurers for certain drugs, tests, and treatments. Prior authorization processes risk delays to necessary care, and surveys show that these delays have led to many patients either abandoning treatment altogether or suffering terrible outcomes. So we're working with national partners and the insurance industry to right-size prior authorization. We're realistic enough to not think that we can eliminate it completely, but we want to push state legislation to address prior authorization and step therapy and advocating for national policymaking organizations for regulation of these programs. So the AMA continues to work on reducing regulation requirements and procedures that interfere with and delay how we take care of our patients. We need to improve the usability of EHRs, to make practice data available to physicians, to hold EHR vendors accountable for their products, and create clear and concise educational resources for physicians to improve their understanding of issues relevant to their practice, like cybersecurity. The last thing I want to touch on before I close is the opioid epidemic. The COVID-19 pandemic is large-scale public health crisis, but it's far from the only one that physicians and leaders in healthcare need to be focusing on. Our nation continues to be in the grip of an opioid epidemic and drug overdose crisis that has party leaders from both sides committed to addressing. Unfortunately, during the pandemic, the rate of opioid-related deaths across our country have skyrocketed. They have not gone down. We have found ourselves in a perfect storm. Fiscal distancing, a dramatic increase in unemployment, and general uncertainty all lend themselves to isolation and anxiety, which are common triggers for substance misuse. The AMA's opioid task force has been working for 6 years to identify problems and come up with solutions. And just last week, we issued a third edition of this task force report outlining some of the steps that have been taken. They're encouraging signs, but we've still got a long way to go. For the last 5 years, there have actually been a decrease in the number of opioid prescriptions. And last year, 2019 alone, there were over 1 million naloxone prescriptions written, up from only 6,000 in 2015. A 64% increase in the use of state monitoring programs, a dramatic increase in the number of physicians that are authorized to prescribe buprenorphine for drug maintenance, but the number goes up. So clearly an issue we need to work on. So these are just a few of the issues that we've been able to take on with the help of our friends on both sides of the aisle. Our patients depend on us to champion the kind of change that we've talked about. So thank you again for having me. I'd be happy to answer any questions, but I believe Senator Johnson is waiting, and I appreciate your hospitality. Thank you.
Thanks, Dr. Bailey. I think we might be able to do one or two questions from the audience, at least one question before before Senator Johnson. One question we have is, how does America re-empower clinicians to treat patients as they deem appropriate versus bending to profit-driven motives of the large healthcare system? So how do we re-empower clinicians at the front lines?
Well, I think that the first thing that we need to do is protect them and then to pay them. The site of service differential changes that have been proposed and that Dr. McEnany mentioned in her wonderful opening talk, I think are a definite start. Physicians need allies like the AMA, their specialty societies, their state and county medical societies to fight with them and be their allies to maintain physician autonomy. I am a passionate supporter of the independent physician. I think that patients want to know that their physicians are working in their best interest and not in another institution.